Very much for staying with us on Dialogue. And this morning we're looking at still tracking COVID-19 pandemic and looking at it from different perspective. Just like I said before, went on that short break. We'll be looking at the Nigeria's healthcare system and of course the need, to get it right, especially now that the country is facing a very huge national emergency. And I told you we'll be engaging the immediate past Executive Secretary of the National Health Insurance Scheme, talking about Professor Usman Yusuf. He's very much, on ground with the healthcare system in Nigeria and what it portends, to the citizens of the country. Thank you very much for joining us, Professor.
Thank you.
Right. The nation is grappling with, a very serious health emergency, the COVID-19 pandemic. Though not in isolation, it's a global challenge. But Nigeria's problem seems to be, came with its own difficulty, which is already existing. The healthcare system, many believe, is not in good shape. As an expert in this field, what's your take on the level of preparedness or the state of our healthcare system before the emergence of COVID-19?
Thank you very much for having me. So this pandemic all over the world is testing three things of all the nations in the world. Number one is the quality of the healthcare of the nation. Number two, the state of governance of the nation. Number three, the quality of human capital, health human capital. If any one of these three is weak, it will be exposed. And the country will suffer tremendously. And that's what you see in many developing countries that are grappling with this pandemic, where the healthcare system is already weak before coming into this pandemic, where governance has always been a problem, where countries have not invested in human capital on health. And this is not something you can buy or do in a month, two, or rush it. It's an investment in humans, it's an investment in the system, and it's an investment in capacity. And any country that has a problem with this, with any leg of this tripod, will suffer tremendously in this pandemic. And we've seen it all over the world. It has come to Nigeria now. We know we've had problems with our healthcare system even before that. Look at what's happening in Kano. Kano people are having problems accessing healthcare because the healthcare system is inadequate to deal with this added problem. Before this pandemic, we've always had issues with malaria, childbirth, deliveries, structured labor, traumas. All healthcare issues now stop. We are all concentration of COVID-19.
Yes. Okay.
That is what all over this country you will see a lot more deaths from these things than COVID-19. So yes, we have a problem all over the third world.
Yeah, but year in, year out, Professor, monies are being budgeted for health sector. Yes, we've been hearing about the expansion of the primary healthcare institutions across the country. But all of this, the emergence of the COVID-19 appeared to have exposed, significant gap in either investment or in our efforts, to improve the healthcare system. Where exactly is the problem? I know you had a running battle, at some point, fighting what you call corruption in the healthcare system, especially at your own level, at the National Health Insurance Scheme and so on. What do you think, that has, what led to where we are today? What led us to where we are today?
Like I said, it's been a long time of neglect of this health sector over the years. It's not this government alone. This government, they've added theirs. But this is a long-term neglect of this sector. And it's catching up with us. I know what I fought in the NHS, I fought the good battle.
Yes.
Do the right thing. A lot of money is given to HMOs instead of investing in healthcare. We have not invested in healthcare. When we were growing up, government then invested in human beings, not roads and bridges. If we do not invest in healthcare system, in education, it will catch up with us. And this is exactly what's happening. No matter how rich you are, no matter how powerful you are, no matter how highly placed you are, you're going nowhere. We are staying in this hospital that you've not fixed. And this is a sad reality, and it's very good. It's a time for sober self-reflection.
Right.
All our leadership in Nigeria, that we are not going to escape with from what we did not do. What we did not do is we did not invest in our people. Healthcare is the lifeline of every nation. Every serious country invested. And it's not just the money. In Nigeria, year in, year out, you see billions invested, billions allocated to this, but where are they? On the ground, nothing to show.
Right.
And in healthcare, you cannot hide it. In education, you cannot hide it. If you don't invest in education, you can never have doctors or nurses or lawyers or engineers.
Right.
And the hospitals will be terrible. And you have money now, you have a private jet, you have visas, but you cannot go outside now. You will have to stay in Nigeria to face the rot we did not fix. This is a sad reality, and I hope we'll do better. But as it is now, we are suffering, and we continue to suffer. And Kano is a case study of irresponsible leadership that is costing the lives of our people.
You said irresponsible leadership, but we've seen how the government in Kano is running helter-skelter to seek, interventions or to seek support from international partners, from the Nigerian government, to handle this pandemic. Do you think it is not doing enough?
Who is not doing enough?
You're talking about, the state government.
Right. Number one, here you are as a governor, your people are dying. In hundreds, cemeteries are getting filled up, and you are denying this disease. This is exactly what is happening currently in Brazil. The president is the COVID denier, just like Ganduje. And look at what's happening in Brazil. Mass graves are dug every day. So you can lie to yourself, but you cannot continue to lie to the people. And who will give Ganduje any money? If I'm the president of the Federal Republic of Nigeria, I will not give him a penny.
Why?
I will tell you why. I mean, there's precedent. What has he done with the previous money?
Which money?
The money that has been allocated to him. We know how he single-handedly crippled healthcare in Kano.
But is it fair to...
If I'm the president, I will tell you if I'm the president what I will do to Kano. I will flood Kano with foodstuff and medical supplies and healthcare workers. So, but I will not give a penny to Ganduje.
Are you calling for a takeover? Are you saying that the government should...
It's not a takeover. This is federal government money. This is our money. We are not going to hand it over to anybody who will put it in his pocket or his daughter's pocket. And this is serious. People need to realize we are in a war.
Yeah. Okay.
Silent from sin killer. And this is no time for political correctness or sitting down and not doing the right thing or half truth or propaganda. Federal government needs to step in and do the right thing to save lives in Kano. People are dying. He can run helter-skelter all he wants, but nobody should entrust him with a penny of people, of Nigerian taxpayers. We should do the right thing.
Are you questioning his integrity or his capacity to manage public resources?
I have written that in print. That it has shown. How can you, as a governor of the state, leading a people, deny a disease that's killing people? And the government panel that went in to see them now is saying, oh yeah, we now agree it's COVID-19. Give me a break. I've been a doctor for 38 years. And nobody can bamboozle me with their life. Patients dying, dropping dead, and you're saying is strange illness. What could be more strange than COVID-19 at this point in time?
Okay.
We are raising our voices to save the lives of our people. not folding our arms to be silent.
Yeah, but I don't think it is time to shift. I mean, to begin to place blames or play blame game. What do we need to do as a nation?
I will tell you. I will tell you why it is time. If we continue to do the wrong thing every time, do you expect a different result? Messenger needs to be called out, and he has been in a subtle way by the federal government telling me, hey, all those deaths are COVID-19. So stop denying. Let's face our reality.
Okay.
Let's come together. There is no politics. There is no APC, PDP. If you say it's politics, go to the graveyard and show me the graves of an APC man or a PDP woman.
Right. Okay.
Our people are dying.
No
time for political correctness.
Okay. No time for political correctness. What do we need to do as a nation? Yes, we agree we have a national emergency that requires urgent attention, unprecedented attention. Now, what do we need to do, short term, perhaps medium term and long term, to address this problem at hand?
Right. If you read my paper, Kano is in a critical situation. People are dying. We need to give Kano all the help we can, and only the federal government has that might. And I suggested the federal government should step in boldly and flood Kano with foodstuff and keep people at home, and flood the hospitals with medical supplies, and give doctors personal protective equipment. Doctors are falling ill from this virus.
Yes.
Give the hospitals medical supplies and drugs. There is no place in Kano now, no health facility that is allocated for patients who do not have COVID-19. And many more of those are dying. Kano Teaching Hospital, the premier teaching hospital in the city, is like a ghost town. Accident and emergency is filled with COVID-19 patients. This is Kano metropolis. Can you imagine what's happening in the rural areas? We are at war. And I do not see the fierce urgency of now. The authorities need to bring into this war.
Right. Okay. The Kano is at war, especially with COVID-19.
No, it's not Kano. It's the whole nation.
The whole nation. Yeah, but the situation is more pronounced now. Looking at what you painted, the picture you painted, hospitals are overwhelmed. People are dying and all of that. So attention need to be focused, on Kano, right?
Yes.
Okay. Thank you very much for talking to us, Professor Usman Yusuf, immediate past Executive Secretary, National Health Insurance Scheme, who has been giving us an insight regarding the state of our healthcare system, especially the level of decay in Kano and the emergency that is requiring the unprecedented attention of especially the federal government. Thank you very much for talking to us once again.
Thank you for having me.
Right. Okay. That has been Professor Usman Yusuf, the former Executive Secretary, National Health Insurance Scheme. And of course, before then, we had Professor Jibril Ibrahim, who also spoke to us.